Hello, everyone, and welcome to episode 223 of the Ortho Eval podcast. I'm your host, Paul Marquis. Today, we're going to be talking about ergonomics and workplace injury prevention in the aging worker. And with us today, we have special guest, Dr. Phil Finemore. We're going to be talking about why we are seeing an older population of workers than ever before. We're going to be going over some of the, risks for injury in these older people. And we're also going to be discussing the role of ergonomics in regards to injury prevention in the older population and so much more. But before we get started, I'd just like to take a moment to hear a word from our sponsors. Welcome back, everyone. So thank you so much for being with us today. I'm so excited to announce that I have Dr. Phil Finemore with me on the show today to help us sort a lot of this ergonomic stuff out. And, we're going to talk about the aging population, and that includes me in the picture. And we'll, as we get older, we get injured a little bit more. We don't bounce back as well. And it's quite, it can be quite an issue. So before we get started, I just want to fill you in on Dr. Finemore. He received his bachelor's of science in kinesiology in 2013 and his doctorate of physical therapy in 2015 from Hudson University in Bangor, Maine. Dr. Finemore has spent the last 5 years treating a variety of neurological and musculoskeletal conditions in outpatient orthopedic clinics in Southern Maine. That experience has proven time and time again that way too many people are being passed around from provider to provider, spending more time in pain and less time living the abundant life they have worked so hard to achieve. That has become Dr. Phil's goal: help busy Maine professionals, executives, and business owners improve physical performance to live a happy, healthy, and wealthy life with their loved ones. Dr. Phil doesn't work for insurance companies. He works with his clients, getting them results that lead to more abundance in every aspect of life. His mission is to make sure the dreams and aspirations of each of his clients aren't derailed by preventable injury and pain. Dr. Finemore became a physical therapist to help people, and that is the number one goal here at Work Fit Me. Originally from Oakland, Maine, Dr. Finemore is an avid outdoorsman and enjoys playing guitar in his spare time. He and his wife, Mallory, welcomed their first child, Brielle, in May of 2019. And Dr. Finemore is also the podcast host of the Strength for Your Purpose podcast. So welcome to the show, Dr. Phil.
Well, Paul, first of all, thank you so much for having me. I've definitely looked up to you as a podcast host, and we chatted a little bit before we started recording here. I've definitely taken a few of the things that you've talked about on the show here and implemented them and found some really good success with them. So thanks for what you're doing, and I really appreciate you bringing me on.
No problem at all. And I really, as we were talking about before the show, and I need to mention this to folks because I think people think that podcasting is really easy. You just kind of turn on the mic and get going. And for some people who have the gift of gab and they can just talk about anything, it could be easy, but there's a lot of preparation to this. I mean, we spend a lot of time getting ready and, fixing things up after and uploading stuff and making sure that it matches up with other content that we have going. So for those of you who are listening, thank you so much. And thank you, Dr. Phil, for doing what you do, because it's really about getting the word out there. And you mentioned in your bio that you do all this stuff for the people of the state of Maine, but guess what? You've got people all over the place listening to you, and the reach is so much further than that. So, thanks for doing what you're doing. Phil and I, we kind of met on social media a little bit. We kind of recognized that we were two guys from Maine, podcasting and trying to do our best to help get the word out. And we also met at a blood flow restriction course last year. And that was really fun. We got a great workout and learned a lot during that. And that was really good. But as far as, what we want to talk about today, Dr. Phil has a lot of information about ergonomics, and I have 29 years of experience learning from my mistakes, learning from other people's mistakes. And, now I'm kind of going through this as, you're still kind of young. But as young people, we think we're invincible and that we can just do whatever we want and work. And, let's talk a little bit about, number one, why is the workforce getting older? I mean, the numbers are staggering. I mean, the numbers have every 10 years double in the millions in regards to people who are older and working.
Yeah. I think There are some obvious reasons. I think obviously the age for retirement to be able to like draw Social Security and things kind of keep creeping up every so often. I think it's like 67 now or something like that to get full benefit and things like that. So that's part of it. Maybe the economy has something to do with it. You know, cost of living in certain places. People are just working longer because they feel the need to have that income if they have the ability to do it. Some people just are loving what they're doing, so maybe they're just hanging on as long as they can. Um, and here in Maine, you know this, Paul, working with a lot of hardworking Mainers throughout your whole career. There, that passion goes a little deeper. You know, it's almost a sense of a sense of who these people are is in the hard work that they do. So I think we see some of that in Maine as well. So that's a pretty, there's a lot of factors that go into it. Some may be a little more obvious than others, and some are maybe a little more cultural or regional than others. But yeah, the facts are there that people are working longer. They're working in jobs that are maybe a little more rigorous on our bodies, a little bit longer, especially in certain regions of the country. And the way things are going, I don't think that'll change anytime soon.
No, I don't think so either. I just, especially here in Maine, you know, one of the things that I see is this sense of pride and this sense of failure if you're not working. And I saw it in my dad when he retired. He kind of went into a depression. He had this sense that he wasn't providing anymore, and that there was just no order in his life for a while there, and got really sick afterwards. And I think we see that a lot in people, so folks end up going back to work just to give themselves some purpose, and also to keep themselves active and moving. And and it's unfortunate that some people feel like they have to do it, and others do it just because they love it, and because that's something they've always wanted to do. Why do these folks end up hurting themselves more than others?
Yeah, well, you mentioned at the top of the show a little bit. It does take longer for us to recover. Certain tissues in our body are not as resilient to repetitive activity, and sometimes it's not the repetitive activity alone that causes these things. Sometimes it's the areas in life that are opposite that repetitive activity we do all day that cause some of these issues. Life outside of work that is really more of the problem. So yeah, I work with individuals and with workplaces doing workplace injury prevention programming, but a lot of what we're talking about is going to spill over well outside of work, because some of the tendencies we have in work, it's really that really affects the things we then do outside of work that can lead to pain. So yeah, the recovery's part of it. The fact that a lot of folks, especially here in Maine, have been doing the same job for years, maybe even decades. So that repetitive stress on the same areas of the body as we get older, and those tissues don't recover as well or recover from injury as well. A lot of people in Maine like to, as you said, they're very prideful people. So if something's bugging them, I can still do what I need to do, even though this is bothering me, and that can build over time as well. So also kind of a pretty multifactorial thing, but I think we've had a pretty big shift and focus on the ergonomics over the years. I think most people will recognize that term and go, yeah, ergonomics. I know it's important. Yeah, and a lot of places put ergonomics in place at their workplace, but a lot of people aren't addressing the physical risk factors of some of those common injuries. And again, I think a lot of them don't always happen at work. I think a lot of aches and pains that maybe then lead to an issue that comes from work actually happen outside of work, but because of our body's response to what we do at work, if that makes sense.
Yeah, absolutely. And it's amazing. We have this tendency to want to blame injuries on what happens at work, but we forget, what's happening at home. And I don't know about you, but I always try to make it a point with folks, and it doesn't have to be the older employee, but I try to emphasize it a little bit more that, work is not exercise.
Yeah.
And that our bodies, as we get older, break down and take a lot more stress and strain. So lifting a pail of water, 5-gallon pail of water when you're 18 years old is relatively easy. You grab a hold of it and you take off. As we get older, you grab a hold of that, your muscle tissue and integrity of that muscle just quite isn't there, and
Yeah.
it's going to definitely be more difficult. So I don't know about you, but I really emphasize that these people exercise on their off time as much as they can. And it doesn't have
Yeah.
to be anything heavy duty, but I try to keep them active, and I really try to educate them on the importance of, work is not exercise.
Yeah.
And it's classic. I'll see people who work in the woods, with a chainsaw and a skidder, and they're working hard, and they come into the clinic and they're like, exercise. I don't need to exercise. I work all day long. You should try to follow me. Then you put them on a treadmill and they're dead in 5 minutes. So that whole education part is important. And I think we need to educate employers about
Yes.
these folks, and just as much as we are educating the employee.
Yeah, no, you're exactly right. That the example I like to give, that first point you made about people have like a physical job, so I don't need to work out, right? I work, a great example, work in the woods, or I'm in the trades, right? I build houses, electrician, plumber, whatever the case might be. I have a very physical job. I don't need to work out. But I kind of equate that to, a lot of people think walking will get them stronger. Well, I just need to walk and move more. And you and I both know, and a lot of PTs know listening, that if you're sedentary, that'll work to a degree, right? Some muscles are definitely going to wake up, get a little stronger, but eventually we're going to build more endurance, and the benefit of that increase in that muscle working is only going to go so far. Same thing when you're doing the exact same type of loading every day, right? There are certain other muscles that you're not really using in those same types of movement patterns you develop that aren't going to get stronger. And certain muscles are only going to get stronger to a point, and then you're just going to level out. So in order to improve the evening out the stresses that are placed throughout the body on a day-to-day basis in a physical job, you're exactly right. Working out is huge. To your second point about talking to the employers, the number one thing that I do initiating a program with a workplace is get the employers on board as to why we're doing this, which goes way beyond covering their behinds from unnecessary workers' compensation cases, and goes to quality of life at work and outside of it for them and their employees. Because you and I both know those people that come in with let's say rotator cuff issues. We're talking about lifestyle things with them outside of their job. We're talking about what they can do during their day at work that's going to help with that, because all those things come into play. And in a lot of cases, with the types of things we help people with in these realms, there's no way you could pinpoint one thing that was the ultimate problem, right? It's a whole cascade of events. So it's really about the leadership being on board so that they can explain, to be a part of the explanation. It's part of what I do too, but be part of the explanation to these employees that this isn't just to make sure that you don't get hurt at work and we don't lose a bunch of money on you. This is to make sure that your livelihood and your well-being throughout your whole life is better and not derailed from something that we can prevent from happening.
Absolutely. There's nothing more important than having a happy employee, working for your company. And, and I do the same thing. I bring the employers in. If we're doing like body mechanics training or talking about how to do energy conservation, working smarter and whatnot, the employer's there. And we'll put the employer through some of the tasks, and so that they get a feel for it and they understand, what it is they're doing. And then, I think there's also a place for pre-employment screening also. And that has been helpful in what we do, because if somebody is just having a difficult time, they work at a lumber yard and they may have to pick up a 94-pound bag of cement. Well, I can go and haul on a 94-pound bag of cement, no problem. But, if I was, another 10, 15 years from now and I try to do it, I'm probably at risk of hurting myself. So, identifying those areas and then just bringing it to the employer's attention so that you can decrease that risk of somebody getting hurt. And I think that when everybody's on board like that, it works so much better. And then, understanding that, some people will get hurt. And would you say that ergonomics can prevent 100% of people's injuries?
No. And the data actually supports that, because over the last at least 10, if not 15 years, we've seen workplace injuries steadily drop. Some years it actually goes up if you compare year to year, but the overall trend on a 10-year trajectory is pretty significant drops in overall injury. But some of the two of the top, like I believe 6 or 8 reasons that people still get hurt on the job are from categories such as just simple overuse, soreness, pain, overuse injuries, and sprains, strains, and tears. Which out of all of the most common, like the top 10 most common reasons people get injured and lose time at work, those 2 categories are the most preventable.
Yeah.
In most cases, the other ones are usually related to accidents or using equipment or falls, and falls can be prevented and stuff too, for sure. But the impact that we can have is definitely in those 2 areas, in that soreness, pain, overuse category, and in that sprain, strains, and tears category. And the fact that those 2 are still so high tells us that this focus on ergonomics that's happened over the last decade and a half is not working on its own. We have to be addressing the physical risk factors that person presents with, that may or may not be from work, but may or may not also be from things they do outside of work, and those 2 meshing and converging together during their day.
Absolutely. Absolutely. What would you say is the diagnosis you see most often in the aging population, the aging employee?
Yeah, I mean, it really depends on the area the industry you're working in. Obviously, right now with the work from home shift, there are a lot of people that were sent home with a computer and figure it out.
Yep.
Here's how we're going to do that. So I like to use the term schneck pain. I'm seeing a lot of schneck pain right now, that diffuse shoulder, neck pain, maybe some ridiculous symptoms down the arm, maybe some rotator cuff issues as well. That's a big one right now. The other big one is low back pain. I think those are those areas right there. Upper extremity symptoms with or without a neck component and low back pain are probably the biggest areas that we're seeing in that aging population, which makes sense. That's where the overuse, our spines in general hold us up all day. So just living day-to-day life without the added stress of a repetitive job task, they're already much more likely to show signs of aging as we progress through life. So add in a repetitive job task to that, and it makes sense.
Yeah. Now I need to talk about this, because I think that, a lot of employers, and we as therapists, are always really sympathetic about, the cost of things. We don't want people to pay too much for the service that they get. You want to, you want to over deliver, under promise, and you want to just make sure that everybody gets a little bit extra. And oftentimes, we approach employers about ergonomics, and the first thing that comes to their mind is like, we're going to be spending some money here.
Yeah.
So how do you approach the employer about this? Like, okay, so we need to make a few ergonomic changes, and oftentimes it's really not a big change, or not a very expensive change. But how do you talk to the employer about the importance of the ergonomic change, even though it's going to cost you a little bit now? How is it going to save you in the future?
Yeah. So I always approach it saying, we're going to look at the ergonomics of the workspace for sure, but the most important part of this program is addressing that person within that ergonomic setup. So we're going to make the appropriate ergonomic adjustments, because one without the other doesn't make any sense. But this isn't a traditional ergonomics training where we're just going to come in and tell everybody how far away they should sit from their computer, where their arm should be, whether they should have a gel pad by their keyboard or not. We're going to do those things, but we're also going to actually do little mini exams on these people based on the type of work they do and the types of aches and pains that they might already have that they're dealing with, and actually address the physical risk factors through a stretching, micro stretching, and even muscle activation and stability standpoint, depending on what the employer and the employees are looking for or what they need. And the other angle we take, that I take with this, is the amount of money you spend on this is going to be nothing compared to what it's going to cost you for someone who's missing work because of a preventable injury. So we're talking on an average injury, we're talking about $1,000 per employee that's injured just to cover their job while they're not there. And this doesn't even take into account the cost of workers' comp insurance changes. So and that $1,000 per person per injury And then that is amplified further from there based on how long they're out and whether they need medical attention or not, which if you are filing a workers' comp case, you are getting medical attention by probably more than one provider. So
Right.
that then amplifies the cost of the injury, the total cost, up to somewhere around $40,000 or more. And that's kind of an average.
Yeah.
So the $1,000 is per employee, right? That $1,000 I mentioned is how much it's going to cost you per employee in that business to keep the business going while that person is out.
Yeah.
And there are going to be costs beyond that you're going to have to foot the bill for. And it's to the tune of about $40,000 on average.
Yeah. And I've seen it way higher than that. I'm sure you have also. In some cases, it's crazy. And then it gets out of hand. And then there's conflict between the employer and the employee. And it just gets deeper and deeper and deeper. And, not only do they have, these physical issues, but they end up with a lot of psychological baggage that comes along with all of that. And, people are looking at me different. They're complaining because I'm not working hard enough. And I'm seeing it, I'm seeing it right now, especially through these COVID times. Patients they're trying to get back to work after injury. And there's this huge push for like, we need more help. You have to do more, but they're on restrictions, so they're getting tons of pressure and they feel bad they can't help. And so trying to round that out and making everybody understand, is one of the hardest things, and getting that all pieced together is so important, as far as making sure that person gets back to being able to be a productive, member in society and have an improved quality of life, so that they're not only happy at work, but they're happy at home, and they're at less risk of hurting themselves, just because they're, everybody's on board.
And so many of these things can definitely be prevented. I'm not going to say 100% of these things can be prevented, because stuff happens, right? They might wind up with a musculoskeletal injury from a fall or something that just was an accident. But things that we typically see in this field, carpal tunnel, rotator cuff issues, cervical or lumbar radiculopathy, those sort of just degenerative over time type injuries, those can be prevented. And those probably make up somewhere to the tune of 70-80% of all workers' compensation cases. I don't know those numbers off the top of my head, but that's just what I've experienced anecdotally.
I would agree with you from my experience also. Yeah, absolutely. It's definitely right up there.
So if we can prevent not only that significant cost savings of tens of thousands of dollars or more for that employer, but we can also save all of the other headaches that could come from this, from a psychosocial standpoint, a mental emotional standpoint, it's a no-brainer.
Yeah. Absolutely. And I think that the other thing that becomes difficult is sorting out, is this injury, I recently saw somebody who had turned and twisted funny and had a knee problem. So I took a look at him and he was ACL deficient, had several meniscectomies in the past. And 20 years ACL deficient. The knee was obviously arthritic. It was loose in all positions. And that little twist and turn probably didn't happen just from that. But, there was a lot of other stuff going on here. And so, that definitely puts a little twist into things, when you have these underlying degenerative issues and trying to figure that all out. So I think that, making sure those employees, report these things right away as soon as they happen. So there's a definitive date. And I think the prevention is key, and making sure that everybody on board is on board. Well, go ahead.
I was just gonna say, that example you gave is a perfect reason why putting a plan in place is so important, because the older we get, the muddier the water there gets, whether this is an actual work injury or whether it's not. And that's going to put even more stress and strain on the relationships between employer, employee, coworkers, and all of that. So if we have a plan in place where we can address those things before they ever become a problem, by putting a plan in place at work, whether these people take our advice of exercising outside of work or not, they're at least doing a warm up and micro stretching and micro breaks throughout the day that are going to lend themselves to not having that major gray area of, was this a problem already, or did this injury actually happen at work? So just take some of the question marks out of it, like, hey, we're working on these things, you know?
Yeah, absolutely. And I always talk to employees that, have recovered from an injury and hurt themselves at work. I always tell them, don't be afraid to tell your coworkers about how that experience was. It wasn't great.
Yeah.
It wasn't fun. And they all say this: had I known back then what I know now, I would have done things differently. And, you get them back on their feet and they think in a different way. And, they're a little more conscientious. They slow things down. And they're like, okay, I'm thinking about how I'm doing this a little bit better. And those, this aging population of people, they're wise. They've learned a lot of things. They have incentive to get better and stay better, because they're like, hey, I'm getting close to retirement. I want to have a good, healthy retirement. I don't want to be incapacitated the rest of my life. And so use these folks to be advocates and say, take care of yourself now so that you can, be better later. And I always take this industrial athlete approach, and where, like we would with a soccer player who maybe tore their ACL or sprained an ankle or whatever, you get that swelling down, you get the motion back, maybe they have surgery and they're coming in and you're starting to increase the weight bearing. And then you start with some straight plane stuff. And then you get into, pivoting and rotating and stuff like that. And then you get them, with a soccer ball in front of them, maybe doing a couple kicks, and then they're running forward. And then you start to add more and more. We need to be doing that with our industrial athletes also. If they are, changing 25-pound blades 30 an hour out of a hogshead, in a wood mill, and they've got to take them and bring them from one area and put them to another, then we need to start simulating those things. And, we don't want them to be Olympic athletes, but we can teach them how to do those activities better, safer, and more, energy efficient, and so I think that's important, so that they feel that there's some sort of a system to how they are going to get better and recover from this.
There's actually some good evidence out there that I've seen where there have been programs where that's the only thing that was a part of their program, was gauging up or down the difficulty of the work specific task. Now, I don't necessarily agree with that in an aging population. You might be able to get away with that with a 30 some odd year old who does mostly office work. You could maybe retrain their movement patterns by just looking at the movement patterns. I think in an aging population where there are a lot of more compensations going on in that body, you're going to have to look at things from a mobility, stability, and working into a strength and endurance standpoint, just like you talked about. But that, what you just said, has to be a part of it, or we're not doing the full job, because all of our great toolbox of exercises are still probably not going to perfectly translate over to the physical demands of those specific work tasks that may or may not have gotten the person to that place to begin with. Right.
Yeah. And sometimes hard to teach and hard to understand, on the employee's perspective. So, great. Anything else you want to talk about in regards to ergonomics in the aging population? I mean, it's such an important thing. We're seeing a lot more of it. I think that we obviously need to talk to employers and have them, be more aware that it is going to become more prevalent, and that we just need to kind of step back sometimes and say, hey, let's revisit this. Yeah, we did some ergonomic training and some evaluations 10 years ago, but maybe we revisit this. We have a new shop, we have a new industry, we have a new company, we have different employees. Let's get back on track with this.
I think the big thing for our profession, physical therapists in general, the best thing we can do when we're working with someone who's already had an injury, maybe we're communicating with the employer, all those things you just said, but so many employers, the minute they hear the word ergonomics, are just like, we've done that, or we have someone that does that. And what that means is they sent one of their employees to a weekend long certification course, and they learned all the stuff that you can Google.
Okay. Or during orientation, how often during orientation do you go and you see they stick an old VHS tape into the recorder, and they sit there and fall asleep and watch these, ergonomic
Exactly.
videos that are like 25 years old.
Right.
And I found the most beneficial thing, to be honest with you, I put my old dirty boots on because I'm a tree farmer also. So I know how to get dirty.
Yeah.
And so I throw my old boots on, my sweatshirt and my jeans, and I go to the workplace and I work with them. And I
Yeah.
actually get in there, I get dirty, I ask them questions, and I tell them, what are the challenges to your job? And
Mm.
and sometimes when the employer is not there, they really open up and they talk about stuff like, I just wish this one thing could be changed. And I
Yeah.
look at it and it's like, this is a no-brainer. We should do
Yeah.
this. And so you send a nice little formal letter to the employer and say, the cost to benefit ratio and whatnot, and boom, they get it. And
Right.
and you're in there and you're getting dirty with them, and they communicate with you so much better that way, rather than being in
Yeah.
there with a suit and tie and telling them what you're talking about, something that they're super familiar with. And
Yeah.
and they think to themselves, what does this guy know about all of this stuff?
Sure.
So
Yeah. Yeah. Being able to get in that world. And then also our profession is so incredibly well equipped to teach the preventative side of things by addressing those physical risk factors for those most common preventable workplace
yes.
neuromusculoskeletal injuries. So when we're talking to employers, whether we're working with them to treat their whole workforce, whether we're working with one of their employees who is injured, and there's whether it is a workers' comp case or whether there's a question of how much work was involved with what they're recovering from, we just need to be talking to them about the need for this across their workforce, because the ergonomics alone is never going to do the trick. We really need to be addressing those physical risk factors to get a full comprehensive workplace injury prevention program in place. And people who are trained in ergonomics don't know that. We are trained in the ergonomics, and we're trained in identifying and addressing those physical risk factors, whether there's pain present or not. So
yeah, it always comes back to anatomy,
yeah.
knowing your
Yeah.
anatomy. And
You
that's
got
the
it.
advantage we have, over a lot of these other folks, is that we know the ins and outs about how the muscles move, how they work, how they function, when they're efficient, when they're not efficient, active and passive
Yeah.
insufficiency, and all these tiny little things, anatomically and kinesiologically, we understand. We can
Yeah.
make those adjustments with much with a better why to it. This is why we are
Yeah.
doing what we're doing. And it makes sense to them. Like I always use this simple little example of active and passive insufficiency whenever I go and I give a presentation, especially when I'm doing like a group that works at a lumber yard, let's say, or maybe in a French fry factory or whatnot. I talk
Yeah.
about being in a good position, being in a bad position when you're doing, lifting activities. So I know this is this could be an audio, but what I'm going to do is basically going to take my hand and I'm going to put it in this neutral position. I'm going to make the OK sign with my index finger and my thumb. And then I have all the employees do this, and I have them keep the wrist in a neutral position. I tell them, take your index finger and try to open up that OK sign. Try to get that circle opened up. And it's hard to do. But then I have them flex the wrist as far as they can and do it again. And they find that, oh, wow, it's really easy to open that up. And that's because all these muscles are shortened on one side and lengthened on the other. And then I have them do just the opposite. We have them extend the wrist and make the OK sign and try to break it open. And it breaks open really easily. So I give them that little demonstration of, muscles need to be in the right position in order for them to work efficiently. And once they do that, it's like, wow, that's crazy. So then, we talk about, being bent over something all day long and then trying to, crane yourself back up, or, vice versa. It's we have to kind of make these things understandable for them, I think. And so that they can see it, they can experience it and understand it better.
And relate it to their quality of life outside of work. Because that's the big thing. One of my favorite kind of shock factor things I always bring up is there's no such thing as perfect posture. Because how many times have we had patients or clients tell us like, oh, my grandmother always said I need to sit up straighter and put the book on my head, all those little adages we hear from people. And if we stayed in one position, even if it was quote unquote perfect all the time, life is inevitably going to ask us to move out of that position. And when we do, that's when problems arise, right? The posture we're in, the repetitive activity we're in, depending on how loaded it is probably not the problem. It's our body's adaptation to that repetitive activity or posture, and not being able to accommodate to other areas of life. That's the big thing. So that's another, getting people to understand that one affects the other. Inside of work affects outside of work and vice versa. But if we can make you happier, healthier, more productive at work, it's also going to overflow to home, which is the end goal that we're all here for.
Sure.
Is to enjoy that. So
Yeah.
that's crucial as well.
And you get to the home quite often, don't you? I mean, you actually go out and see your clients at their place of work or at their home. Is that what you do?
Yeah, fully mobile. So yeah, I work with people in their offices sometimes. I meet them at their homes, kind of wherever is really most convenient for them. So, and that's been great too, because like you said, in the clinic, we can simulate things. But when I'm at home and someone says, well, stairs don't really bother me unless I go down my basement stairs or whatever. Okay, show me. And they can actually show me where the problem is, and we can help fix the problem and do any modifications we need to do now, and then work into it from an exercise perspective so that we can get rid of some of that modification. They don't have to worry about it, and they can go back to the activity without thinking about it and not have the problem that they're dealing with.
So practical. I love it. I love it.
Being in that environment has been huge for people. People are getting better faster. I'm noticing they really are, because we're able to really specify the treatment to the things that are their biggest problem.
Yeah. And right now what we're seeing is that people can't get into therapy, or one of the reasons they can't get into therapy is because and this is not a slam on anybody, because by all means, I understand the barriers, but a person gets hurt. It takes a long time to get into their provider because they're just overwhelmed with, lack of workers because of COVID, or, there's just, it's difficult. Then they need maybe some diagnostic testing. You get an x-ray. Well, after the x-ray, you might want an MRI. Well, it could be taking 4 to 6 weeks to get an MRI. And then some people feel like they can't get to therapy until they've had an MRI. And we know that's not true. We know that we can clinically, rule out the really bad stuff and rule in the really good stuff and get started and, prevent this from getting worse. And I think that's super important is, let's not let ourselves get into a bad place. And let's take care of this now. And I think, one of the biggest signs and symptoms of an overuse problem is fatigue. You don't necessarily have to have pain in an area, but just having some fatigue in an area is like the number one, sign that we've got to look into this a little bit deeper. And I think just making people aware of that and getting the word out is so important.
That's huge. I've always done this because I had the luxury of talking with some professionals who have been in the field a really long time and have done this throughout their career too, and passed it along to me. Everybody I get in front of that maybe went through that same path that you just described before they got to me, and within their time in PT got the results they were looking for. I go, there's no way for me to know this, but I think the results you've gotten after, let's say 6-8 weeks, could have maybe happened more closer to 4 to 6 had we not done all of this stuff beforehand that we probably didn't absolutely need to get here. And I always tell them, obviously do what makes you feel most comfortable, but in the future, something pops up, you can just come right in here. Teach them about direct access, teach them that regardless of what your MRI or X-ray shows, we are taught as professionals to pick up things that are maybe more serious and need that attention, and things that don't, and things that we can get treated conservatively right now. So teach them that we have that direct access. Almost all insurances now don't require that at all. There are a few select plans that do require that referral, but those hurdles can be crossed as well. That's why we have other great support staff within our clinics and wherever we work to help us get over those hurdles. But we can at least get someone started on some treatment, and we can figure those other hurdles out later. So I preach that in my marketing. I preach it when I'm in front of everybody that I'm in front of, especially if they didn't come to me through a direct access situation, they were referred from another provider, and create those lines of communication. And our entire field doing that is going to progress that along and honestly make us look better, because it's already impressive that people can deal with something for 3-4 months, 6 months, a year, and get better in a couple months.
Yeah.
The amount of time they spend in pain versus the amount of time it actually takes them to get rid of it can be pretty short if we're doing a good job.
Yep.
So let's show them that can be even shorter if we get here even sooner, and let's make that the norm.
Absolutely. Totally agree with you. And I always tell them, tell Dr. Google to hang it up and to not get too involved with that. I've seen more people I kid you not, in the last week, I've seen more people who've injured themselves doing stuff that they've learned online.
Yeah.
I mean, it's crazy. So I really try to discourage that as much as possible. And, I look toward, I have them look to people who have a lot of experience and, who've seen a lot of stuff. And the more you see, the better you get. And the more you can give back and give back immediately and more effectively. So, well, Phil, I can't thank you enough for being on the show today and talking to us about, ergonomics and the aging workplace. I think it's something we definitely need to keep. And my wheels are spinning now that you're talking about doing things at home and stuff like that. And, these people who are stuck home on computers, there's got to be some sort of education for them so we can do it in the masses. And so I love that because, I've been at this for over 29 years now, and I learn every day. You and I were talking about it before the show started today. I open a book once or twice a week. I'm looking at articles, and there's always something new out there. We're learning more all the time. And, it's up to you, on where you want to stop. And I think getting that fire burning and continuing and helping people is, what we do. And I'm glad to see you have that and that passion to make people better and to connect people, which I think is even more important. I think having, great connections is the key to getting people better and to doing what we do best. So if somebody wanted to get in touch with you and, either in regards to Work Fit Me or, your podcast or anything like that, or had questions, what's the best way to do it? And I can, what you can tell us now, but I'll also add that stuff to the links in the show notes today, so people can just click on it and get to you. Yeah.
Everything is the kind of catch-all place is right on the website. There's little hyperlinks to all of the social media for Work Fit Me, as well as my email, phone number, contact information. So you can find that stuff on the website. The podcast is the Strength for Your Purpose podcast, and the socials for that are at Strength for Your Purpose pod. So you can look that up on any social media platform, and that should pop right up. And you can listen to that wherever you are listening to this podcast. So Apple Podcasts, Spotify, anywhere you can get a podcast, you can listen to that. So the website is workfitme.com, and socials at WorkFitMe, at Strength for Your Purpose pod. And those are all the places that are the easiest way to find out more and reach out and chat if you'd like. I'd love to hear from anyone that has questions, want to talk shop, or want to learn more about what I do, because they're in need of some of that help.
Yeah, I think the work that you do is it's very unique, and I think we need to see a lot more of that. Get back to the the house call type thing. I've done them, and to be honest with you, some of the most rewarding patients I've ever worked with were the house calls that I've done. Hey, I'm going by your place, I'll stop by and take a look at this or take a look at that or do this or do that. And people absolutely love that, and they're in the comfort of their own home. And that's what it's all about. So I thank you so much again for being on the show today. Really appreciate it. And I definitely hope to be able to connect with you again in the future and have, talk about other topics, and keep doing what you're doing. We really appreciate it. And I'm sure that everybody out there who is listening to you really appreciate it also. So, and for those of you who are listening to our show, thanks again for listening. We really appreciate it. And all of the great comments we've had lately on Apple Podcasts have been absolutely flattering. And I just can't go through all of them. It would be, I'd probably tear up because I'm kind of a softie that way. But that's why I keep doing what I do. And I really appreciate all the great feedback. So be sure you check out our new videos on YouTube. We've put up a ton in the last couple of weeks, and we've had a lot of fun doing that. And we have a lot more to come. We've hit a lot of milestones this year, 450 videos on YouTube, just past the 9.2 million mark on views, and our podcast's over 300,000 downloads. And you know what? I never thought I'd be here. Never thought I'd even get a quarter of the way here. But now that I'm here, I want to keep going, and I'm having fun doing it. So,
Yes.
So Dr. Phil, thanks again for being on the show, and thank you all for listening today. Take care and be kind to each other.
Thank you, everybody.